Hey everyone, welcome back, future orthopedic surgeons. Ready for another deep dive?
Always ready.
Perfect, because today we're tackling some heavy hitters,
Mm.
spinal and foot and ankle biomechanics. And you know what? Mm, This stuff is going to be pure gold, especially if you're prepping for those FRCS exams or really any of those tough postgraduate exams out there.
You bet.
For this deep dive, we're going to be using the Ortho Made Simple notes from mokyingren.sg.
Great resource.
They're made by Dr. Mok Ying Ren.
Oh, yeah.
He's a sports surgeon, by the way, at National University Hospital over in Singapore.
Nice.
And get this, he aced his own FRCS exams back in 2022. So we're in good hands, right?
Definitely in good hands.
All right, so spinal stability
Ah.
sounds pretty straightforward, right?
Mhm.
But I feel like, and maybe you can help me out here, there's got to be more to it than just like having a rigid spine.
Oh, absolutely. You're right. It's not just about being rigid. It's really this dynamic interplay of three, I guess you could say, key systems. You've got your muscles. Those are your active players, right? They're providing that dynamic support. Then you've got your ligaments. Those are like your passive restraints. They're always there, keeping things in check. And then, of course, we can't forget about the nervous system.
Oh, yeah.
Right. That's the control center. It's orchestrating everything, making sure the right muscles are firing, with the right force at the right time. Kind of like a conductor leading an orchestra.
Ooh,
Yeah.
I like that analogy. Okay, that makes a lot of sense. But how can we really visualize this whole system working together?
Okay, well, let's go back to basics. Think of a ball and a bowl.
Okay.
So the ball represents your spine, and the bowl represents that stability provided by all those systems we were just talking about.
All right, I'm with you.
So when the ball's just resting at the bottom of the bowl, that's your neutral zone, right? That's like the happy place where your muscles and your nerves are just like effortlessly doing their job.
Okay, that makes sense.
Now, as you move, that ball starts to roll up the sides of the bowl, right? And that's where you're entering the elastic zone.
Uh-huh.
And this is where those ligaments are like, whoa, 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 hold on, buddy, you're going a little too far. So they keep everything in check, keep you within a safe range of motion.
Okay, that's a great visual. But here's a thought. As we get older, does that bowl, does that change at all?
You're absolutely right. You're thinking ahead here. So yeah, as we age, that bowl does change. You start to get those bony spurs, right? Or osteophytes. And then your facet joints start to thicken up a bit. And it's really the body's way of compensating for all that wear and tear that happens on those ligaments. It's like it's trying to reinforce the bowl,
Yeah.
Trying to add a little bit of extra support,
Interesting.
keep things stable.
So it's almost like a trade-off then.
Yeah.
Like we might lose a bit of that range of motion as we age,
Yeah.
but it's actually the body's way of trying to keep everything stable and safe.
Exactly. And this whole concept of the changing bowl, it's directly related to how we understand and manage back pain. Think about it. If your pain-free zone starts to shrink and it falls within that neutral zone, now you're going to be experiencing pain with even just like the tiniest bit of movement.
Okay, so that's where things like physiotherapy or even surgery come into play, right?
Yeah.
Trying to manipulate those zones and, well, manage that pain.
Exactly. So physiotherapy, that's going to strengthen those muscles, right?
Yeah.
And give you better control over that neutral zone and hopefully bring it back within your pain-free range.
Right.
Now, fusion surgery, that's taking a different approach.
Yeah.
Fusion surgery is essentially shrinking that bowl. It's drastically limiting that elastic zone so that even with less mobility, you're staying within that comfortable, pain-free zone.
That's pretty neat. All right, so those are great concepts for getting the overall picture. But us orthopedic residents, we love the specifics, especially for those exams. Are there any radiological signs of instability that we should totally burn into our memories?
Oh, absolutely. It all comes down to millimeters and degrees. So in the cervical spine, you're looking for more than 3.5 millimeters of translation or 11 degrees of angulation between vertebrae. Thoracic spine, we're talking 2.5 millimeters or 11 degrees.
Okay, so it's a little different for the thoracic.
It is. And then lumbar spine, that's where we go back up to 4.5 millimeters or 11 degrees.
Got it.
Write those down, tattoo them on your brain, whatever you got to do to remember those.
Those numbers are officially locked and loaded. All right, let's move on to the cervical spine. What's so fascinating about it from a biomechanics standpoint?
Well, for starters, did you know that most of the movement in your neck, it actually comes from just two joints? Yeah, the occipitoatlantal joint, that takes care of most of your flexion and extension. And then the C1, C2 joint, that's your primary rotator.
Wow. Two joints doing all that work. And speaking of the cervical spine, there's this little anatomical tidbit that I always thought was just trivia. But
Mm.
now I'm starting to see how it could actually be really important clinically. So the vertebral artery, it only travels through the transverse foramen from C1 to C6. It actually skips C7 completely.
Uh-huh.
Why is that detail so important? Why do I need to know that?
You're picking up on the subtleties here. It's crucial to know the course of that vertebral artery, especially when you're dealing with trauma or planning surgery in the cervical spine. One wrong move and you could be in big trouble.
Okay, yeah, I definitely don't want to mess with that.
Yeah.
All right, let's switch gears now and talk about the lumbar spine.
Sure.
One of the things I find myself explaining to patients all the time is, hey, when you're lifting something heavy, squat down.
Yeah.
How do we make that biomechanics concept clear to them without, overwhelming them with all the jargon?
Free body diagrams. Those are your best friend. Imagine the lumbar spine as a lever, right?
Okay.
When you squat down, you bring the weight closer to your body, and essentially, you're shortening that moment arm, not only of your own body weight, but also the load that you're lifting. So what does that mean? Less compressive force on those intervertebral discs.
So it's all about minimizing that stress on the spine. And I'm guessing, would I be right in saying that sitting with a load is like the worst case scenario?
You hit the nail on the head. Imagine this. You're sitting down, you got a weight in your hands, you've basically created this long lever arm extending from your hands all the way to your lumbar spine.
Oh, boy.
And guess what's acting as the fulcrum? That poor anterior longitudinal ligament.
Ooh.
Your paraspinal muscles are working overtime trying to counterbalance that weight. And those discs, they're not happy.
Yeah, definitely squatting from now on. No more sitting with heavy things. All right, speaking of keeping ourselves healthy and functional, let's move on to the foot and ankle.
Yeah, let's do it.
It's easy to kind of forget about down there, but it plays such a huge role in our overall biomechanics. Where should we start?
Let's start by giving some love to what I call the unsung hero of the foot, the talus.
Ooh, the talus. I'm intrigued.
It's often overlooked, but this little bone is a workhorse. It acts as a torque converter, and get this, without any direct muscle attachments.
Whoa, that's amazing. It's like the lunate in your wrist?
Yeah.
Just quietly doing its job.
Exactly. So how does this torque converter actually function in the foot? Well, think of it as a mitered hinge. So as your tibia rotates, the talus is expertly converting that rotation into either inversion or eversion at that subtalar joint. And at the same time, it's causing supination or pronation in the forefoot. It's like a perfectly choreographed ballet, just seamlessly transferring motion from one part of your foot to another.
I bet the posterior tibial tendon is pretty important in all of this, especially during that powerful push-off when we're walking.
You know it. The posterior tibial tendon is essential for locking that transverse tarsal joint. You might also hear it called the Chopart joint. So during inversion, it locks that joint up. And what does that do? It creates this rigid lever arm so you can push off with maximum efficiency.
So it's all about creating that solid structure for propulsion. Okay, now we've got to talk about the plantar fascia.
Oh, yeah, the plantar fascia.
I feel like it's way more than just a simple arch support, right?
Oh, absolutely.
Yeah.
The plantar fascia, it's this dynamic structure, acts like a truss, spanning from your heel all the way to your toes. And it's crucial for maintaining the proper joint reaction forces, not only in your ankle, but also in your first metatarsophalangeal joint.
Hold on, so you're saying problems with the plantar fascia can actually impact my ankle, A&D, my big toe.
That's right. And it really emphasizes why understanding these biomechanics is so crucial. Now, put your surgeon brain on for a second. Imagine this free body diagrams we were talking about earlier. But this time, I want you to picture specifically the ankle and that first MTP joint. What happens to those joint reaction forces if someone has pes planus, flat feet? Or even more dramatically, what if their plantar fascia ruptures?
Okay, let me think about this. So with pes planus, the arch is collapsing, which means the plantar fascia is not as taut.
Yeah.
So that would logically increase the stress on the ankle joint.
Right. Yeah.
Because it's not getting that extra support from the windlass mechanism.
Exactly. You're thinking like a true biomechanist now. And when that plantar fascia ruptures, well, now you've completely lost that crucial truss-like support.
Oh, man.
And this can lead to even greater stress on the ankle and could even contribute to problems further down the line, things like hallux valgus or other forefoot deformities.
Wow. It's like a domino effect. One structure goes down, and suddenly the entire system is thrown off balance. This really highlights how important it is to catch these issues early on, before they snowball into something way more serious.
Absolutely. And that's where having that strong grasp of biomechanics, that's where it really becomes crucial as a clinician. Whether you're choosing orthotics, recommending physical therapy, or even considering surgery, You need to understand how those choices are going to affect the forces acting on those joints.
This is making so much sense now. And you know what?
Mhm.
This is exactly what I love about Dr. Mok's Ortho Made Simple notes.
Yeah.
He takes these really complex biomechanics concepts and breaks them down into like bite-sized pieces that are so much easier to understand and remember. Remember, everybody, all of this is just a click away at mokyingren.sg.
Yep. Couldn't agree more. You know, it's a testament to the power of clear, concise explanations. When you strip away the jargon, you can focus on the fundamental principles, and it makes all the difference in truly understanding and retaining this knowledge. And let's be honest, that's critical when you're prepping for those big exams like the FRCS.
Absolutely. So as we wrap up this first part of our deep dive into spinal and foot and ankle biomechanics, what are your key takeaways? What's that nugget of wisdom you want our listeners to walk away with?
I think for me, it's just remembering that everything is connected, right? The spine, the foot, the ankle, they all work together in this this beautiful dance of movement. And when one part of the system is out of whack, it can have these ripple effects throughout the entire body. We can memorize all the facts and figures we want, but truly grasping those biomechanical principles. That's what separates, a good orthopedic surgeon from a truly great one.
Beautifully put. And before I forget, for those of you studying hard for your FRCS exams or any equivalent exam out there, remember that these amazing insights are based on the Ortho Made Simple notes over at mokyingren.sg. Now, before we move on to the next level of detail, I want to leave you with a final thought, a little challenge to keep those brains buzzing.
Okay, I like it.
So thinking about everything we've talked about so far with spinal and foot and ankle biomechanics, how would you approach a case of instability or dysfunction in either of those areas? What surgical approaches would you consider? What about rehab strategies? And most importantly, why? Let those questions simmer as we take a quick break, and we'll be back soon to keep this deep dive rolling.
Looking forward to it.
Me too.
See you in a bit.
See, so, we were talking about the talus and how it's this amazing torque converter.
Yeah.
But it's all part of a bigger system, right?
Right. And that actually makes me wonder, how does the plantar fascia play into all this?
Oh, good question. It's like the strong silent partner to the talus,
Remember we were talking about it acting like a truss going from the heel to the toes?
Yeah.
Well, that structure is crucial for keeping the right joint reaction forces, not just in the ankle, but also in the first MTP joint, that big toe joint.
Wait, hold on. So you're telling me, if something's off with the plantar fascia, it can mess with both my ankle and my big toe.
You got it. And it just goes to show why understanding biomechanics is so important, Ren.
Sure.
Okay, now let's put on our surgeon hats for a minute.
Okay, love it.
Those free body diagrams we talked about earlier?
Yeah.
Think about them again, but this time, focus on the ankle and the first MTP joint.
All right.
What happens to those joint reaction forces if someone has pes planus? Flat feet, Or even worse, what if their plantar fascia ruptures?
Okay, let me think. So with pes planus, the arch collapses.
Exactly.
That means the plantar fascia isn't as tight as it should be.
Right.
So that would put more stress on the ankle joint.
You got it. Because it's not getting that support from the, what was it called? The windlass mechanism.
Well, windlass mechanism, yeah, that's right.
Yeah.
And if the plantar fascia ruptures, well, then forget about it. You've lost all that support.
Exactly. That can lead to way more stress on the ankle. Then it can even cause problems later on, like hallux valgus or other forefoot problems.
Oh, so it's like this chain reaction.
Yeah, pretty much.
One thing goes wrong, and then, bam, the whole system's out of whack. We got to catch these things early
Great.
before they turn into something major.
Absolutely. And that's where knowing your biomechanics really helps you as a clinician. Whether you're picking orthotics or recommending physical therapy or even thinking about surgery, you got to understand how those choices are going to affect the forces on the joints.
It's all connected. I'm starting to see the big picture now.
That's what we like to hear.
This is what I love about Dr. Mok's Ortho Made Simple notes.
Oh, yeah. Great stuff.
He explains these really complicated biomechanics things so clearly, it's easy to understand and remember. And don't forget, everyone, you can find these notes online. Just go to mokyingren.sg.
Yep, that's the place. It really shows how powerful simple explanations can be. When you get rid of all that fancy jargon and just focus on the basics, it makes all the difference, especially when you're studying for those FRCS exams,
Totally agree. So as we finish up this part of our deep dive into the spine and the foot and ankle, what are, your biggest takeaways?
Well, I think for me, it's the reminder that everything is connected. The spine, the foot, the ankle, they all work together, right? It's
Yeah.
like a team effort. And when one player is off, the whole team suffers.
Makes sense.
We can memorize all the facts in the world, but it's really understanding how it all works together that makes you a great orthopedic surgeon.
I love that. And for anyone out there studying for those big exams like the FRCS, remember these insights are all from the Ortho Made Simple notes. You can find them over at mokyingren.sg. Definitely worth a look. Now, before we jump into even more details, I've got one last thought for you. A little challenge to keep those brains working.
Ooh, I like challenges.
So, with everything we've learned about the spine and foot and ankle, how would you approach a patient with instability or dysfunction? What kind of surgery would you do? What about rehab? And why? Think about that for a minute.
Good one.
We'll be back soon to dive even deeper into the world of orthopedics.
Can't wait.
Yeah, that's what it's all about. You got to think critically, apply what you know, and figure out the best way to help your patients.
Exactly. And as you're going through those practice questions and case studies, really keep those biomechanics principles in mind. They're going to help you find the most effective solutions.
Couldn't have said it better myself. Well, this has been fantastic. A great refresher for me, and I hope it's been super helpful for all you listeners out there, too. We covered so much in, like 20 minutes? And it's all thanks to Dr. Mok and his awesome Ortho Made Simple notes.
Yeah, he's got a knack for making things easy to understand,
Totally. And remember, everybody, you can find those notes over at mokyingren.sg. Whether you're cramming for those FRCS exams or just want to brush up on your biomechanics, it's a gold mine of information.
Seriously, it's such a good resource.
Absolutely. So to all our fellow orthopedic residents out there, keep those brains working, keep studying hard, and keep those Ortho Made Simple notes close by. We'll catch you on our next deep dive into the amazing world of orthopedics.
See you then.